Good afternoon, everyone. Thank you for joining us today for our COVID update of the week. And thank you for all of our public safety and public health experts on this call. Dr. Asha Shah, Jody Bishop-Hullen, our Director of Public Health for the City of Stamford, as well as our Director of Public Safety, Ted Jankowski. And we look forward to hearing from all of you. I'm going to start tonight with just an update on where we are this week and my overall mayor's message for the week, which is three things. First, we are unfortunately seeing a spike in COVID-19 cases, an increase in our daily positivity rate, an increase in hospitalizations. And we didn't want to be in this place, but this is where we are. And so we are encouraging everyone to wear masks indoors. We're going to talk more about that a little later on this live stream and about the mandate that we've put in place, practicing social distancing and proper hygiene, and getting vaccinated, getting boosted, and staying healthy during the holidays. That is the weekly message. Just to dig a little bit into the data, as you all know, we've unfortunately seen a spike in cases. In fact, the cases have quadrupled since Thanksgiving. We are now at over 40 cases per 100,000 for the 7-day average, and our daily positivity rate has jumped from 6% to over 8% since Thanksgiving. We're seeing an increase in hospitalizations. In fact, hospitalizations have tripled in Fairfield County compared to Connecticut statewide, and you'll hear more from Dr. Shah on our local numbers in Stamford. The one good news is we are one of the most vaccinated cities in the state. Stamford's second, just after West Hartford. Over 97% of individuals 12 and over have initiated vaccination. And overall, we have nearly 85% of our population is vaccinated. So I want to say a big thank you to all of the nurses and frontline workers and our health officials at Stamford Health, CHC, at the city for your leadership and efforts to get our community vaccinated. Reminder for folks to get out there, get vaccinated if you haven't, and get your booster ahead of the holidays. That is our message this week. And with that, I'm going to turn it over to Dr. Shah, who's going to share more data from Stamford Health's perspective and from Stamford in particular, and some updates on the Omicron variant. And then we'll hear from Jody, and then Ted Jankowski will provide more details on the mask mandate that we've implemented. So I will turn it over to Dr. Shah.
Great, thanks, Mayor Simmons. I'm going to try to share my screen. Okay. So just to kind of piggyback on what Mayor Simmons said about some of the trends that we're seeing around the state and here locally, this shows the number of new cases in Connecticut as a state. We've seen a dramatic increase in the case numbers over the past several weeks. And we've seen similar increases in hospitalizations around the state, similar data that Mayor Simmons showed, which is in this blue line here. We're now well above 800 hospitalizations statewide. And to give you a sense, back in October, we were hovering around 200 for quite some time. So that's a very sharp increase. In terms of the breakdown of counties, New Haven County continues to see the majority of the COVID hospitalizations, but Fairfield County is right there at 21% in this blue pie here in this pie graph. And we continue to see the majority of hospitalizations are being driven by individuals who are not vaccinated. And so about 70 to 75% of this total state census on a day-to-day period is unvaccinated. We still see about a quarter or so those individuals being admitted, being fully vaccinated, and we're still collecting data on their booster status. But again, being unvaccinated puts you at very high risk of requiring hospitalization for COVID. And another trend that we watch very closely is the community transmission of COVID. And this is from the CDC, again, which looks at the percent positivity by county, and it also looks at the case rate per 100,000 population. So this here shows Fairfield County. We're in the red. We're in a high transmission zone. In fact, the entire state is in the red. And, over the past week, there have been 3,500 cases reported in Fairfield County. And you can imagine that's probably a slight underestimation because home tests are not included in this data. And there's a lot of use of home tests out there for diagnosis. And so the number's probably even higher than this. If you look at this map here on the right, this shows the case rate by town. And again, nearly the entire state is in the red zone. So, these are concerning trends that we're seeing and that we're watching very closely. In terms of our Stamford hospital data, we look at our percent positivity every week. It's a number that we pull every Monday morning. This week, we shot up to 13.88% positivity, which means out of all of the tests that are done through the Stamford hospital testing site, 13.8% of those were positive. We have not been at a level this high in a very long time. We have seen a tremendous demand for testing, but we've also seen a tremendous number of positive cases. And this is a trend that, that again, it will likely increase even more, unfortunately, but something that's concerning. And not to forget that flu is still around as well. So last season, we saw no influenza, which is represented by the green bar here in this graph. But this season, we are starting to see some flu. We had about 50 flu cases last week. The week before that, we had 40. So it's not rising at the rate that COVID is, but it's still present. And it's still causing people to get flu-like symptoms and runny noses. And sometimes it's difficult to distinguish that from COVID. So it's important to get tested. If you have symptoms, it's good to get tested for COVID and flu if possible, to kind of help figure out, which infection that you have. So those are kind of some of the trends that we looked at in terms of, making recommendations about public health measures here at the hospital, and, in conjunction with the Department of Health and with Mayor Simmons. But the other thing we're following very closely, of course, is the emergence of the Omicron variant, which is a new variant of concern. It's spreading very quickly throughout the United States, which is what this picture shows here. So this is the percentage of new cases that are due to the Omicron variant. And you can see here the week ending on the 18th of December, which was last week, 73% of the cases in the United States were Omicron. So that's just a percentage of the new cases that are being reported, but that is quite alarming. Similar data for the Northeast. So this is looking at Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. 37% of the new cases reported as of last week, over the period of last week, were the Omicron variant. The state of Connecticut does put out data like this every week, and that data is due out this Thursday. And we're expecting that a similar trend is going to be seen in terms of the spread of this new variant. So what we know about Omicron is that it seems to be very contagious. It definitely spreads more easily than the original SARS-CoV-2 virus, which we saw in the spring of 2020. Probably spreads more quickly than Delta, but we're still kind of learning about that. People with Omicron can spread it to other people, even if they're vaccinated, even if they're asymptomatic, which is why mask use is so important. It's seemingly that Omicron may cause less severe illness if you're fully vaccinated. So that's a very important point. Individuals who are unvaccinated or immunocompromised continue to be at risk for severe disease from COVID, no matter what variant it is. But in fully vaccinated individuals, so far what we've learned is that the symptoms seem to be milder than with Delta. But again, we're still learning about that. The current vaccines are expected to protect against severe illness, hospitalizations, and death. And in fact, more and more data is evolving to show that 3 doses of either Pfizer or the Moderna vaccine seem to be effective against disease from Omicron. So really promising news, and another reason to go out and get a booster if you're eligible and you haven't already done so. In terms of treatments for Omicron, we are likely going to see a decrease in the efficacy of our monoclonal antibody treatments. That's something that we are evaluating on a daily basis. and adjusting our treatment options and protocols accordingly. So with that, I will stop sharing and pass it over to Jody, I believe.
Good afternoon, everyone. Thank you, Dr. Shaw. Thank you, Mayor. Let me start this. Okay, so I'm going to give a little more data. I have the school data, and we have seen a pretty sharp increase in our cases in our schools. 87 cases were reported from 12/11 to 12/17, and an additional 62 so far since last Friday. There are the middle school and high school cases are primary right now, and these include the staff in those schools. But the rise in student cases over the last month is proportional to the rise in staff cases. And not only that, it is appears to be rising in proportion to the community. So our public school related cases are about 25% of our city's cases, and it's just it's within the range we have seen this school year. So that's not to say that we are seeing transmission in the schools or children are getting it in schools, but it is just to highlight that we do have community transmission, as we've been discussing, and children they live and play in the community, so they are exposed and can get COVID. So when we give you all this bad news, you start to think, feel a little bit helpless and hopeless, but we really want you to have some tools to protect yourselves and your family. And we're going to talk about some of those tools now. We have testing available in the city. It is very busy right now, but we are working to increase our testing capacity in the city, working closely with the state and federal government to ensure we have adequate testing resources. Right now, for the next 2 weeks, we have testing at Cove Island Park. This is a recent change. It changed from being at Stamford High because it was so busy and there was a lot of traffic. It is going a little bit smoother having it down at Cove Island Park. So that will be in the afternoons for the next few days. Please watch carefully. You can check our website, watch for updates on social media as to when the sites are open. Because of the holiday, things are a little different for this remainder of this week and next week. Other testing locations, mostly by appointment, including Stamford Hospital at the Wheeler Building, are at these locations, and you can call for an appointment. Doc's Urgent Care, Dr. Fort, CVS Pharmacies, Stamford Hospital I mentioned, Community Health Centers on 5th Street, and the Urgent Care on Summer Street. So the CDC has recommended as yet another strategy to reduce the spread is to perform an at-home test. And as Dr. Shaw mentioned, these tests, the data is not collected by the state or reported, or supposed to be reported. But what we would like to do as the Department of Health is encourage you that should you have a positive test, that you do notify our contact tracing team at this number, 203-836-3348, and that will help us help you, give you guidance in terms of what to do for isolation, guide you on your close contacts and those close contacts, what they should do in terms of quarantine, and it will just give us more information as a city to keep ourselves safe. We also are hoping that anyone who hasn't been vaccinated will get vaccinated, if you're eligible, and that you will get a booster if you're eligible. So we do have several walk-up sites. Again, the times are changing on this for this week and next week because of the holiday. But we do have availability at Henry Street in the South End. That's our community health clinic, at the government center. And at Scalzi Park, the Community Health Center does offer vaccines at Scalzi Park. They will be closed. We will be closed from the 23rd to the 25th at the Government Center in Henry Street, but Scalzi is open on the 23rd and closed on the 24th and 25th. There are also the other sites that you can get vaccines. As in terms of Stamford Health, you can get an appointment, and the pharmacies and some shopping centers do have vaccines as well. Coming after the holiday, going into the new year, we will be offering some alternative sites. In January, we are going to open up 2 of our park sites again. They will be winterized, they'll be comfortable for you to go and get a vaccine or a booster shot. Remember that we have many children that still need to be vaccinated. We're encouraging everyone to bring your child if they're eligible. We have trained nurses that will give you a professional education and administer the shot according to professional guidelines. So we are encouraging everyone to get their vaccine, 1st or 2nd doses, or booster shot to protect yourselves as much as possible. Okay, so that's what I have, Mayor.
Great. Thank you so much, Dr. Shaw and Jody, for those excellent presentations and for all of your work to combat COVID-19 and keep our community safe. So I am going to turn it over to our Director of Public Safety, Ted Jankowski, who's going to share more about the mask mandate that we have put back in place. And I'll just give a brief overview that it will go into effect tonight at 8 p.m. That is tonight, Tuesday, December 21st. This is an executive order that I signed, and the goal is to protect the public health and public safety of the residents of Stamford due to spiking COVID-19 cases, due to the increase in hospitalizations, and due to the fact that we're heading into the holidays, and we want to get ahead of this as much as we can so that we can keep businesses open, keep our schools open, keep our economy going, and hopefully contain this as we head into the winter months. And this mask mandate will help ensure that everyone's wearing their masks indoors where we know that transmission is high. And this is one of the most effective ways that the CDC recommends that we can reduce the spread of COVID-19, reduce hospitalizations, and keep you and your family safe and keep our economy open for longer so that we can avoid shutdowns. So with that, I'm going to turn it over to Ted, who's going to share more details. And if you have any questions about this, throughout this live stream or in the future, you can also email Mayor's office at stanfordct.gov with any questions. And I will turn it over to you, Ted.
Thank you, Mayor. I can share my screen, correct? So thank you, Mayor. Very important that we are implementing this mask mandate, emphasizing everything that our residents have heard by Dr. Shaw, by you as Mayor, as well as our Director of Health. And you mentioned it, but I want to emphasize it again. It's important to have this mask mandate, and CDC studies has showed a great reduction in the number of new cases when a universal masking was implemented. The number of deaths have decreased, and then again, the hospitalization growths have really decreased too. And what people aren't aware is we mask at these junctures really to protect ourselves, but really to protect the vulnerable within our population. And we do have the immunocompromised who they cannot receive the vaccines, We're in the process of increasing our vaccination rate for that 5 to 11-year-old, but we're only at 25%. So we still have 75% of that population who have not received vaccinations. And there is no vaccine yet for that 0 to 4 age group. So again, it's very important for everybody to wear masks. We all have to do our part, and this is one way of doing it. And Mayor, I could tell you from my perspective, I wear a mask wherever I go outside. If I go into any type of an indoor public setting, I make sure that I have my mask. And I think what you're going to be proud to hear is right now there are a lot of residents that are already wearing masks. So it does give us a level of safety. But I want to go into the mandate in a little bit more depth. Apartment buildings, multiple family dwellings, office buildings, and houses of worship. Masks are required indoors in public areas of all buildings and businesses. The executive order applies to common areas of apartment buildings, multifamily dwellings, hotel lobbies, and offices where there is public gathering. Masks are recommended, but not required in private offices, not accessible to the public. For the retail and personal services businesses, masks are required to be worn by all staff and customers. The mask mandate guidelines for restaurants and movie theaters. Restaurant employees shall wear a mask while working indoors. All patrons are required to wear masks at all other times when inside the restaurant. And what that we mean by that, if you're sitting at a table and you have food or you have beverages there, that's when you can take your mask off. But if you do get up to use the facilities, or if you get up for any other purpose, that's when we're asking residents to put that mask back on. While dining indoors, patrons must wear those masks when not actively eating or drinking. And then when dining outdoors, patrons are not required to wear masks. However, if for some reason they have to go inside, that's when they will be required to utilize that mask. The executive order does not affect occupancy levels, hours of operation, and does not require social distancing barriers. These were issues that we confronted early in this pandemic. At this point, that's not something that we are looking to curtail. We do want our businesses to thrive. We do want our residents to get out there and enjoy themselves, but we want everybody to enjoy themselves safely. And then movie theater patrons shall wear a mask unless they are actively eating and/or drinking. And staff must wear masks while serving the public as well as while in common areas. For gyms and sports facilities, and this is a question that we receive a lot. And believe it or not, Mayor, my phone has been ringing off the hook by some of the gyms and sports facilities. So I want to provide a little clarity, and we will have that press release going out, and we will have this information on our website. But masks are required for indoor areas of gyms and sports facilities. Masks may be removed for activities where athlete participants and/or individuals working out can keep a safe social distance of at least 6 feet, but must be replaced immediately following the activity. Now, the concerns that we've heard, if I am working on a treadmill, it's very difficult for me to have that mask on. Again, we want to make sure that everyone is safe, but if you can maintain that safe distance, and we will have our citation officers and our environmental inspectors going out there to work with each of the establishments to answer any questions. And again, we want everybody to work out safely. And we want to make sure that we work with the owners of all businesses. So, but those masks are required to be worn in common areas, changing rooms, and snack bars. Masks should be removed when there is a possibility of getting wet during swimming and immediately replaced upon completion of the activity. Now, this next bullet is something that is new. We are working with Connecticut DPH. They provided guidance for interscholastic youth and other amateur sports activities. And their recommendation is, upon proof of full vaccination, masks may be removed while actively participating in a game or other official contests. Masks are to be worn, though, by participants during practices, sitting on the bench, spectating, and all other times during entry and exit into the facilities or into the contest itself. And then please remember that food service areas are to follow those restaurant guidelines. The wearing of the mask unless you're eating or drinking. Now, the enforcement, I had mentioned that our citation officers are going to be out there. I had mentioned that our environmental inspectors are going to be out there. Again, we are looking for compliance. Our goal is not to fine individuals, but we need to work together to make sure that everybody is safe. So they will be out there. They will start going out there this evening. Again, working with the business establishments to make sure that everybody understands the mask mandate and the updated guidance. Establishments currently are responsible for employee compliance. Non-compliance will result in warnings and/or fines. We hope that we do not give out any fines, but the reality is that we do have to enforce. If we do encounter a person who's in violation of the face cover requirement, it is a $100 fine. If we encounter an employee who is not wearing a face covering, the business is fined $100 per employee. So this is something that again, we are asking residents. And Mayor, one thing that I love about Stamford residents, they do work with the Office of Public Safety. They do listen to our messages, and they have helped us get through other different types of crisis and disaster. So I am hoping that we're going to continue on that path. And the mask mandate, you have an excellent team. We're going to continue to evaluate. We're going to continue to review the data, and based on the information that we're receiving, we will potentially make recommendations leading into the future too.
Great. Thank you so much, Ted, and for all of your work and leadership, keeping our community safe. And I will just close by again thanking our public health officials, Dr. Shaw, Jody, for your leadership, all of your work for the past 2 years, keeping our community safe, ensuring individuals get vaccinated, being on the front lines with testing and stopping the spread of COVID-19. And, to everyone listening, we just want to thank you for your cooperation. I couldn't be more proud and inspired by our community, the way that we've come together for over 2 years now amidst this pandemic. And I know that we're all tired of this and ready to get back to normal. And I'm confident if we can all just hang in there a little bit longer, follow these mask protocols, get vaccinated, get boosted, be smart over the holidays, that hopefully in the new year, 2022, we're going to see this come to an end at some point very soon, and we're going to be able to return to normal. So we thank you all for your cooperation. We wish everyone a happy and healthy holiday season. Please stay safe, and please reach out to us at the city if there's anything we can do or any questions you have. Email us at mayorsoffice@stanfordct.gov. So thank you very much, everyone. Happy holidays, and we'll see you again in 2 weeks.